helping patients get back on their feet. Quite literally, PAM Health of Southern Indiana's network of rehab and post-acute care hospitals are focused on helping patients recover from illness, injury, and complex medical conditions. And they're just right over the bridge. Their mission is all about restoring lives through compassionate, high-quality care that makes a real difference for patients and families. Here to tell us more are the CEOs, Misty Dennis and Chase Taylor. Thanks for joining us.
Thanks for having us.
Thank you. How are you?
Good. I love that we are highlighting this Wellness Wednesday every single week on Great Day Live. Of course, we had to kick it off with both of you. So, Misty, tell us a little bit about PAM Health and all the services that you guys provide over in Southern Indiana.
Thank you. So we're an acute inpatient rehab hospital. What that means is we take a holistic approach to healthcare. So we see the patients with complex medical conditions. We offer physical therapy, occupational therapy, speech therapy. We have psychology, nutrition. So we're really able to treat the whole patient inside of our system.
It sounds like you guys are really a one-stop shop when it comes to all things health and wellness, which is so great because a lot of times you have to go to all these different offices, but it's so nice that you're just conveniently located right there. And so, Chase, how is PAM Health really different from just a traditional hospital?
So in a traditional hospital, patients are really there. You're really there to sort of get over the acute illness that brought you there. Mm-hmm. For us at PAM Health in a rehabilitation facility, largely you've gotten over those things, and now it's time to focus on rehab. Mm-hmm. It's to focus on getting you back to where you were before you had the illness or insult that brought you there. Mm-hmm. So we really take our time to make sure with our physical therapy, occupational therapy, and speech therapy to really get those 3 hours a day, 5 days a week, very intense rehab. So much different than a traditional hospital, yeah, but still receive the same care you would receive on your typical med-surg floor or telemetry floor in a hospital.
Mm-hmm. It sounds like you really like to work one-on-one with the patient, because I know some other physical therapy places, for example, sometimes they're working on 2, maybe 3 patients at one time, but it sounds like you are really trying to just work one-on-one and really get them back to where they were. And so what makes rehabilitation post-acute care just different from other facilities? Would you say it's that one-on-one care?
Absolutely, it's the one-on-one care. But at PAM Health, one of our values is care with compassion. And what that looks like is this program that we have internally. It's called the We Care program. And all of our leaders are involved in this program. We do daily rounding with all of our patients, and we ensure that all of their needs are being met, that they are progressing through the system. And, that extra layer of support with all of our leaders is very valuable. And it just sets us apart. There are other acute rehabs in the area. Mm-hmm. There are subacute levels of care, and all of those, they have their place as well. But I think we just really make it an effort to focus on each individual patient.
Mm-hmm. Focusing on that one-on-one and also focusing on what they're trying to recover from too. So why is specialized care really important when it comes to an illness, surgery, or an injury?
With our specialized care programs, we're able to tailor exactly what a patient needs based on what has happened to them. If somebody has had a stroke, mm-hmm, then we have, again, our PT, OT, and ST to deliver that highly specialized care and really ultimately get that patient work with them one-on-one, and wherever those deficiencies are, we're able to really spend a lot of time on that deficiency. If say somebody can't swallow very well or speak very well, then we have speech therapy to really spend a lot of good time with those patients. And it's the same with our occupational therapy and physical therapy.
Mm-hmm. And 5-star experience means so much to you. So you personally, being a CEO of the company, what does that directly mean to you?
It really encompasses the entire stay. And it would be very easy to talk about just the stay itself and the facilities and how well our nurses treat you or our case managers, and that would be the sort of the easy answer, right? Mm-hmm. But really, what we do for a 5-star experience is the outcome. So what's the outcome in a rehab hospital? It's being able to get up in the morning and get yourself dressed and get yourself, brush your teeth and take a shower and walk to your car and drive. We have a car that we can sort of help patients get in and out of to understand how to do this after their illness or injury. And I think all of those specialized services are really what the 5-star experience is at PAM Health.
And you are inviting so many people to come out to your open house to experience all of this. It's happening on April 16th. So what can people kind of see and do while they're there?
For our open house, we want you to meet our team. I'm not the star of that show. The star of that show is really our PT, OT, ST, and that's physical therapy, occupational therapists, and speech therapists. It's really our nurses. It's really our physicians. It's really that care team we want you to meet. And we'd like for you to see the facility. It's a great facility, but I think beyond that, the facility is the people, the hospital is the people. That's what we want you to meet and see.
And I totally agree with you. So thank you so much for stopping by the show today. And we're going to see them every single Wednesday, so we appreciate the partnership.
Elle, thank you so much.
Thank you.
You are so welcome. So again, to learn more and mark your calendars for their open house coming up on April 16th, head over to pamhealth.com.